In 2002, Dr. Winke collaborated with Mares in the most recent evolution on the RGBM algorithm, which takes into account the most recent studies performed in this sector. Thus, the RGBM Mares-Winke algorithm was born. The Mares-Winke algorithm is indispensable for anyone who takes multiple and repetitive dives. Further, the algorithm adopts data correlations for bubble correction factors, using statistical analysis. The Mares-Winke algorithm is the first to introduce deep compression stops, increasing the possibility for microbubbles to be eliminated. But what are microbubbles? They can be explained using common analogies. In a stream where the water encounters an obstacle or uneven surface, gaseous bubbles form. Blood flow in the human body can be compared to the water in a stream. The walls of the blood vessels and tissue surfaces have small uneven patches and sinuous recesses in which a gaseous micronucleus can be created, basically a seed from which a microbubble can form. The microbubbles then tend to agglomerate to form a larger bubble, which then grows even further by absorbing the gas already dissolved in the blood and tissues, and by Boyle expansion on ascent. The bubble, growing even larger, can reach a point in which it obstructs a blood vessel. Thus, an ischemia is formed, that is, a reduction of blood flow in a vessel that feeds tissues and organs, which, due to a lack of oxygenation, can develop pathologies. Or the bubbles can grow in tissue sites directly and push on nerves as they grow larger. And then mechanical distortion pressure on the nerve sites produces pain and damage. In both cases, the problem can become very severe, with the onset of the symptoms of decompression sickness. Let's take a closer look at the microbubble phenomenon. Remember that tissue tension is defined as the pressure of a gas in a tissue, and pressure gradient is the difference between two pressures. For more in-depth information, you can visit the technical sub-menus. The bubble has a layer of gas molecules that borders the external tissues, producing a thin barrier called surface tension. The physical phenomenon that allows mosquitoes to walk on water without sinking, or a needle to stay on the surface if placed on a liquid. Surface tension is a sort of elastic net, a membrane that demarcates the border between the gaseous area and the liquid. This membrane's resistance causes pressure inside the bubble to be greater than ambient pressure. If the gaseous pressure in the bubble is greater than the tissue tension, the gaseous molecules will move from the bubble towards the tissue, thus decreasing the size of the bubble. In the opposite case, the bubble will continue to grow. Because of a physical law of bubbles, Laplace's law, the smaller the bubble, the greater the difference in pressure between the bubble and the external environment. Laplace established the law according to which the pressure difference, delta P, is inversely proportional to the radius of the bubble. For example, a bubble with a radius of 4/1000th of a millimeter has a pressure that is a good half atmosphere higher than the external pressure. This difference in pressure creates a situation in which the gas molecules scatter from the bubble towards the tissue very quickly. The bubble decreases in size, and the difference in pressure continues to increase. Under these conditions, then, the bubble tends to disappear. It is intuitive, therefore, that the ideal is to keep the bubbles as small as possible. Thus, the difference in pressure will be greater, as will the rate of transfer of gas from the bubble to the tissue. In order to create conditions that lead most of the gas contained in the body in free phase, that is, bubbles, to pass as quickly as possible into the blood and become part of the dissolved gas, it is thus necessary to achieve a substantial difference between the pressure inside the bubble and the tissue tension. Therefore, the ascent must be optimized so that the bubbles do not become too large. But in order to keep the bubbles sufficiently small, it is necessary to wait longer at depth. This is the origin of the deep stops. Decompression stops at greater depths than usual. Let's consider a real example. For a dive up to a maximum depth of 165 feet, we could have a deep stop of 1 minute at a depth of about 70 feet. Let's summarize the characteristics of decompression models prior to the event of the RGBM algorithm. Decompressions with the dissolved gas models established that the gaseous exchange was determined solely by the local gradient. A higher local gradient corresponded to a higher rate of exchange, staying in any case within the parameter established by the Haldane principle. In practice, this was done taking the diver directly to a point near the surface. But this model did not take into consideration the phenomena tied to the presence of gas seeds. In fact, in the human body, we can estimate that the gas present is 90% dissolved in the tissue, while the remaining 10% is in the form of bubbles. The study of the bubble mechanics makes it possible to keep their number and size within set limits. Other peculiarities hidden in the study of microbubbles are the importance of the rates of ascent and descent. Departure from the bottom must be slow because that is where the first bubbles form. And then 33 feet per minute up to a deep stop, and again 33 feet a minute from the deep stop to the decompression stops. During the descent, it would be advisable to descend quickly, at least 66 feet per minute, compatibly with the problems of inner ear and sinus pressure equalization. This behavior allows the bubbles, which are already present in our bodies anyway, to undergo a rapid reduction in volume, a phenomenon known as crushing. Now, let's compare the same dive performed using the old dissolved gas model and using the new RGBM Mares-Winke algorithm. The RGBM Mares-Winke algorithm, while employing nearly the same dive times, noticeably increases safety margins. RGBM Mares-Winke, the algorithm of the future for safer dives.